Today, let's talk about a medication you've probably heard whispered in online hair loss forums, Dutasteride. Some call it the nuclear option against hair loss. Others worry it's too strong. As a hair transplant surgeon, I get asked all the time, should I switch from Finasteride to Dutasteride? In this video, I'll break down what it is, how it works, what the evidence says, the risks you should know, and where I personally use it in my practice. Dutasteride was originally approved for a condition called benign prostatic hyperplasia, basically an enlarged prostate. But researchers noticed an interesting side effect. Patients were losing less hair. Why? Dutasteride blocks the enzyme called 5-alpha reductase. And not just one type, but two different types, type 1 and type 2. Finasteride only blocks type 2. Dutasteride blocks both. What does that mean in practice? It reduces the levels of DHT, the main hormone driving male pattern hair loss, by over 90%. Compare that to Finasteride's 70%. It's like upgrading from a standard lock on your door to a vault door. Male pattern baldness is all about DHT sensitivity, even if your testosterone is normal. If your follicles are sensitive, DHT miniaturizes them. Finasteride slows that down. Dutasteride, it turns down the DHT almost completely. In fact, biopsy studies show that scalp DHT is nearly wiped out when patients take Dutasteride. So in theory, it should mean stronger results. But is that really true? Let's look at the data. One famous Japanese study compared Finasteride and Dutasteride head-to-head. After 6 months, the Dutasteride group had significantly higher hair counts. Another 3-year study showed that Dutasteride maintained hair density better over time, especially in men with more advanced thinning. In Korea and Japan, Dutasteride is actually approved as a hair loss treatment, while in the US it's still technically off-label. In my clinic, I've seen patients who plateaued on Finasteride start to see new thickening when they switch to Dutasteride. Of course, not every patient responds, but the overall evidence is strong that it's more effective. Now, let's be honest about the downside. Because Dutasteride is more powerful, some patients worry about sexual side effects. Low libido, erectile dysfunction, and reduced semen volume. The actual numbers? Clinical trials suggest about 3 to 5% of men report these issues, slightly higher than Finasteride, but not dramatically. The bigger concern is that Dutasteride stays in your system for a very long time. Its half-life is 5 weeks. Compare that to Finasteride 6 hours. So if you take one pill today, in a month you still have half of it in your body. That means if you get side effects, they may linger longer, even if you stop. There are also some theoretical concerns, like effects on fertility if taken long-term, though data is still limited. Who should actually use this drug? In my practice, I usually start patients on Finasteride first, unless they have advanced hair loss. If they respond well, great. If not, and especially if they're young men with aggressive balding, then Dutasteride becomes a very reasonable option. It's also useful for men in their 30s and 40s who've already stabilized but want stronger maintenance. But I generally don't start a 22-year-old with early recession on Dutasteride right away, because sometimes a lighter touch is enough, and we want to minimize unnecessary risks. How do we actually prescribe it? In Korea, we often use Dutasteride as a capsule, but some doctors prefer alternate dosing. For example, 2 or 3 times a week instead of every day. Why? Because even at lower frequency, the drug is still in your body due to that long half-life. Some clinics also use injections of Dutasteride directly into the scalp, called mesotherapy. This is still experimental, but some patients prefer it if they want to avoid systemic exposure. To wrap up, Dutasteride is one of the most powerful tools we have against hair loss. It's more effective than Finasteride, but also more persistent and potentially more risky. For the right patient, it can be a game changer, but it's not a casual vitamin you just pick up. It should always be taken under medical supervision. Remember, hair loss treatment is a marathon, not a sprint. Dutasteride can be part of the plan, but it's never the whole plan.